October is Breast Cancer Awareness Month, and one controllable way you can prevent cancer is to make sure you have enough vitamin D. HealthTexas founder Dr. Roland Reyna is here to tell us how vitamin D deficiency can really impact other areas of your health. Thank you so much for being here.
Thank you, Fiona.
We were talking earlier, and you had mentioned no one kind of really talks about this, and that's true. I've never really talked about the possibility of vitamin D deficiency. How common is that diagnosis?
You know, probably 95 to 98% of all Americans have this. It's said that if there was one thing that we could do as Americans to lower the risk of death, it would be to get people to take sufficient vitamin D, to get their levels up. Because what happens is that you cut the risk of 18 different cancers in half. So by taking something that costs pennies a day, you cut the risk of cancer, including breast cancer, in half. You cut the risk of heart attack and stroke by 40%. You cut the risk of Alzheimer's disease. These are the things people die of every day.
Right, and it all helps. Now, if someone isn't taking a vitamin, or even if they are taking a vitamin, how much vitamin D should they be taking?
You know, we get most of our vitamin D from the sun. But the problem is, who goes out into the sun anymore? To get enough sun, you have to be out in the sun for about 8 hours a day with a bathing suit without any sunblock. Nobody's going to do that.
They don't want to do that.
And nor should they do that.
Right.
So people say, well, I'll just drink some more milk. Guess what? You're going to have to drink about 3 gallons of milk to get enough of it. So you just take it by mouth. Take a vitamin. You know, anywhere from 2 to 5,000, sometimes up to 10,000 units a day. But when I check people, the problem is that the vitamin D level says it's normal if it's 30 or above, 30 and above. But you don't really start having the significant benefits until you get to, if you want to cut the risk of heart disease, you want to get to a level of 55. If you want to get to a level of cutting cancer, you get to a level of 70 or 80. So right off the bat, you know, you go to your doctor, they say, oh, your vitamin D level is 20. Oh, you're fine. It's close to normal.
Close enough. It's not.
Not even close.
Right, because it's not close to optimal.
It's a question between normal and optimal.
Right.
The heavier that you are, or the darker that you are, as you're darker, we don't process it as well. So your level is going to be very, very low. I mean, it's not unusual to have people at 4 or 8. And again, they should be 70 or 80. So this is pretty amazing stuff.
So increasing your, you know, the vitamin D that you're taking will help. What other ways can you treat it?
Really the best way of doing it, I mean, you can be out in the sun, but you really have to be out in the sun a lot. You can drink milk, you can do other things, but really the best way of doing it, just take a supplement. I mean, it's easy, it's cheap, it's safe. There are a couple of rare diseases that people should not take it, but that's really relatively rare. For the majority of Americans, if we did this, we'd cut the risk of death significantly of the things that people die of.
Now, you had mentioned the risks earlier, but it was 40% higher risk of heart disease and stroke, right?
That's right.
If you don't have enough
vitamin D. If you're
vitamin
deficient,
D, right.
40% higher risk. So right off the bat, people come in, they have a family history for heart disease, get them to take vitamin D. They have a risk of cancer, regardless as to whether or not they have a risk of cancer. Get them to take vitamin D. Alzheimer's, osteoporosis. People who have vitamin D deficiency have higher risk of diabetes, of being obese. I mean, it affects everything. It's really involved in the metabolic processes of a lot of things, of insulin metabolism. So if it's low, you develop diabetes.
Right. Okay, so increase that vitamin D intake.
Very important.
Yes, all right, to get help with vitamin D deficiency or to get a blood test to see how your levels measure up, make an appointment at HealthTexas, the HealthTexas location near you. Just call 210-731-HTMG. That's 210-731-HTMG. That's 4864. Or visit their website, healthtexas.org.